What if the 2024 Change Healthcare cyberattack had targeted medical devices instead of billing systems? Chinese hackers could have seized control of ventilators, insulin pumps, and pacemakers across thousands of hospitals. Devices would display normal readings while delivering lethal doses. Hospital staff would discover they couldn't manually override the compromised systems. ICU evacuations would begin immediately as life support turned deadly. Within hours, nursing homes and home patients would face the same terror. Emergency services overwhelmed nationwide. The attackers could target specific demographics, programming devices to fail based on insurance providers or medical profiles. Over 200,000 internet-connected medical devices currently lack basic security. Healthcare networks remain America's most vulnerable critical infrastructure, a digital weapon targeting the most defenseless.